the important role of AAPCHO is to work with community health centers that deal with populations of minorities that are underserved or not served at all.
Well, AAPCHO is very important because when we're talking about the Asian American, Native Hawaiian, Pacific Islander population, we need to be able to elevate the issues of our community health centers and the issues of our patients.
Because of AAPCHO, the sensitivity to Asian American, Native Hawaiian, Pacific Islander issues is so much more heightened.
I've certainly respected AAPCHO's leadership with regard to community health centers, how to strengthen them and support them, and we follow the lead of AAPCHO in that regard.
We've always looked to AAPCHO to be our advocate, but I think it's more than just political advocacy. I think AAPCHO has the ability to prove the value of what we really do as health centers.
There are unique contributions that AAPCHO makes. For example, you have, as an organization, have focused a lot on enabling services, including collecting data around them, and that's sometimes at least as important as the actual services that are delivered inside an exam room. But more broadly, it's really important to have that reservoir of expertise and that ability to link various grantees that are serving the needs of that health population. And that's what an organization like this can help to do. Connect those health centers so that they're not feeling like they've got to act in isolation, but rather that they become part of a learning community. They're pulled together and can benefit from each other's expertise and strengths.
We've been participating in several different projects with AAPCHO over the years, and we started off with the Pacific Innovations Collaborative. And what that allowed is it built the infrastructure to be able to collect quality data out of our EMR system, our electronic medical record system. So it gave us the ability to do quality improvement because now we had the data on our patients.
For us at NAC, having a collaborative partner like AAPCHO has been crucially important. They have relationships with members of Congress, with folks in this administration, with other community leaders that we, quite frankly, and even our other health center members don't have. And that just adds to the value of our partnership. It allows us to accomplish even more. We couldn't do that without this partnership and without the presence and support and leadership of AAPCHO.
Since the Health Forum and AAPCHO have been there and joined by many sister organizations in DC, there now are places to go to really talk to the administration about the needs, to talk to members of Congress about how to really reach the communities that we serve. And in particular, having been there in the early days when AAPCHO was first organized with I think only about 8 or 9 or 10 community health centers across the country serving our communities, and now with nearly 30 health centers across the country, that growth has been so important, and that accessibility for poor and underserved communities is really critical.
As AAPCHO, we have a mechanism to take our voice also to Washington, D.C. that's been very effective. AAPCHO is now working on ways to provide more consumer input into AAPCHO itself, and therefore be able to take the needs of the consumer and the patients to the policymakers to make sure that funding, access to care, delivery care continues to have the voice of the consumer involved.
To have those, the information that we get from the field, from AAPCHO, and convert that into policy. If we don't have it, then our communities suffer. If we don't have it, then our policies become less focused and less elegant. If we don't have that, the recruitment and of people to go into these fields with language and cultural competencies will not happen.
Congratulations. 25 years, a quarter century, is a major achievement. And I hope that all of the members and supporters in AAPCHO will take great pride in having achieved a quarter century of growth and success. I look forward to the next quarter century of working with AAPCHO as it grows in influence, and accomplishments and achievements.
Congratulations on your silver anniversary. We're so happy to have this shared history together, and we look forward to the next 25 years together.
Well, congratulations to AAPCHO on 25 years. You've come a long way, and now AAPCHO is a major player in healthcare, and it's very well respected. So all the best wishes for the next 25 years.
Live long and prosper. Be better, be stronger, be loud, especially in these times.